Hey there, this is Dr. Evan Osar, just working on my single leg balance and ball control, or I should say with a ball throw. Welcome to this edition of Discover IMI. Hope you're having a great Saturday, great start to your weekend. In our Instagram post, Discover IMI on Instagram, I shared a story about a woman that I played pickleball with, and she recently fell for the second time and she broke her wrist. So she needs surgery, plate screws in her arm to repair a broken arm. And she's just a few years older than me, so maybe early 60s, so not very old at all, relatively speaking. 60 doesn't seem so old to me now that I'm in my mid-50s. However, the point that's important for us to understand as health and fitness professionals is even our relatively healthy, she's a healthy young woman, she's a healthy woman. I play pickleball with her. We have a good time. We win quite a few matches if we're playing against the right opponents. However, this is the second time she's fallen. And she said she was telling her friend, she turned and then she just lost her balance, went to catch herself, and she broke her arm. So I want to discuss a very common cause of balance related issues that not too many people discuss. However, it's impacting quite a few of our relatively older clients. And that's the cervical spine, and how the cervical spine, the blood flow to the brain through the cervical spine impacts our client's balance. The vertebral arteries are two arteries that come off your subclavian artery somewhere around where my fingers are pointing, right behind your collarbone there. They go up through the cervical spine to perfuse or to supply the brain with blood. So we have two of them, obviously, one on either side, so that when we turn our head to the left, it pulls the right side tight. The left side should be open because it's a little more relaxed, and we still get blood flow to the brain. Vice versa, when we turn our head to the right, then the left one is sort of decreases its blood flow, and then the right one should supply blood to the brain. So we don't lose blood flow to the brain when we're turning our heads. Now, this reminds me of a story, or should say, I want to share a story of a good friend of mine who passed away last year, unfortunately. However, she was mentioning to me, and this is another important lesson, don't treat or train closely your family or friends. It's not a good idea because sometimes you lose perspective because you know them so well. And she was a dear friend of mine, and she had been telling me that she was losing her balance. And I heard it, I didn't put much attention to it because, I saw her walking in and walking out. We went to lunch, weekly. So I saw her all the time. I didn't see any balance related issues. Then one day we're walking to lunch. She turns to look at me and she stumbles. I'm like, what was that? Did you trip on something? She's like, no, I told you I'm losing my balance. And I'm like, oh, that's one of the things that, I was very negligent on, not listening to her closely enough. So at our next visit, I'm like, we need to check this. So one of the tests that doctors will often do for balance issues is they will have the client turn their head, lift their chin up. So what that does is it closes off that one vertebral artery, so the other one's open. So you're checking the relative blood flow in the artery that's still open. And when she did it to her right side, no problems. The right side was fine, no problems. When she turned her head to the left side and lifted up her chin, as soon as she started to lose her balance. So I'm like, oh. So that tells us there's a decrease in the blood flow of one of her vertebral arteries, which is why so we watched her walk. I had her walk, turn her head to one side, no problems. I should say turn her head to the right side, no problems, because the right side stayed open. When she turned her head to the left side, which decreases the right side, and she should have an open blood flow on the left side, she instantly lost. She started to stumble. So it told me that she's got a vascular cause of loss of balance. And this is a common cause for so many of our older clients because they get this condition called spinal stenosis. And we think about spinal stenosis as it relates to the nerves, the spinal cord, and the nerves that are coming out of the neck or the low back, going down the arms, the nerves coming out of the neck, going down the arms, that can cause tingling, numbness, weakness in the arm or down the leg as well. But we don't think about it from a vascular standpoint. But again, those openings where the openings where the arteries are going, they can also become stenotic and close off the blood supply. And it can be asymmetric. One side can be open, one side can be closed. And that's what was impacting my friend. So I took her to the dizzy doctor, actually called the dizzy doctor in Chicago. At the time, he did all his tests and he's like, yeah, you're right. It's not the visual system. It's not the vestibular system. It's not her somatosensory system. It's the blood flow to the brain. Not a lot we can do about it besides surgery, and that's not a great option. So your best option, he told her the best option was just to work with Dr. Osar. He's in the best position to help you. Just create better length through the neck, decrease myofascial tightness that constricts and compresses that nerve on top of the spinal stenosis, and just do things that you can to establish and restore optimal range of motion to the best of her ability, given the degenerative changes. So I want to share with you that story because many of our clients, as I mentioned, are losing their balance because of that rotation issue or those degenerative changes that impacts their rotation and impacts that blood flow to the brain. So what can we do about it? Number one, you want to teach your client. First, if you know that's an issue, you can always assess your client, stand them against the wall. So if you're next to them, I should say, if you're with them in person, stand next to them, test them. Just have them turn their head one side, bring the chin up, hold it for about 30 seconds, and see, it should cause no change in their balance. Check both sides. If they start to get a little woozy or lose their balance, then you should send them out to their medical professional to be reevaluated, or I should say further evaluated for that issue, okay? If you're not with your client, make sure they stand. They can either sit or, actually they have to stand because you need to see their balance, but put them next to a wall. So that way you turn their head, look up, hold it for 30 seconds. So that way if they get a little woozy, they can just lean against the wall and or lean against the wall on one side. So if you do this test, make sure you're next to your client and or they're by a wall so they don't, if they do lose their balance, you're right there to catch them or they're able to support themselves very easily, okay? Next, if it's shown that that's what your client has, this degenerative changes, spinal stenosis that's causing blood flow restriction, next thing you want to work on is the things that are within your control and within your scope of practice, okay? So number one, teach your client how to create a longer spine as if they're being pulled up from the backside of their head and neck. So you want to create spinal length and keep that spinal length. The more your client compresses down the tight muscles around their neck and upper back and are in this posture, the more compromised that range of motion will be, as well as the constriction on those blood vessels, restriction on those blood vessels will be. So long spine. Number two, breathe. You gotta get them breathing using a more optimal breathing strategy. Get them breathing through their more through their midsection of their thorax using a better diaphragm strategy. So that way they're breathing this way, around versus this way where they're overusing your neck muscles, which is going to keep compressing down on their neck. So again, we taught her, we put a strap around her abdomen and chest. We taught her to do that 3 times per day with a long spine position. Lengthen your spine, do 3 sets of 5 breaths, breathing around the thoracolpelvic cylinder, relaxing, keeping your neck relaxed. Then train her or train your client to learn how to dissociate their thorax from the neck. Because again, when you're walking, you want to keep the eyes relatively looking straight forward, but there's going to be times when your client is walking and they have to turn their head to look for traffic or to the maneuvering around a corner or the grocery store, maneuvering around individuals. So you need to teach them how to rotate and keep that long spine. So a very simple drill is just have them go in split stance. So right leg forward, left leg back. They can just cross their hands on their chest or across their shoulders, breathe in, keep your eyes focused forward, and just breathe out, stay long through the spine, and then just breathe out and rotate. Breathe in to come back to center, breathe out and rotate. So that way you're moving, they're still creating relative, as I turn my trunk and spine, thoracic spine to my right, my head is staying straight forward, but that's relative left neck rotation, okay? So it's relative left neck rotation. So that way I'm working within a range of motion the client can control without any loss of blood flow that's going to challenge your balance. And I can do several repetitions to one side and then compare it to the other side. So left leg goes forward, right leg is back, cross the hands, and now I can rotate. Again, keep the head looking straight forward. So that way we're teaching them how to dissociate or move the trunk, the thorax, and spine, thoracic spine, and trunk, rib cage, around a stationary head. And then if they're able to, then you can progress into now moving the head and neck through the good range of motion that they can control. You may want to do and probably need to do some myofascial release through the neck or send them to a therapist if it's out of your scope of practice, send them to a therapist who's trained to specifically work with these individuals so that you can teach them, or I should say, have them work on some manual work. Because again, many of these clients, I had to do some manual work with my friend so that she could create better soft tissue release of her neck, create a better opportunity for a long neck position, and also the person that works with this individual has to understand where the vertebral arteries are so that they're not going to irritate them further or create any vascular issues. So I hope that makes sense. I hope that helps create a long spine, teach your client how to breathe so they're not overusing those accessory muscles of respiration, the SCM, the sternocleidomastoid, the levator scapula, and even the scalenes. Scalenes are more primary, but again, the scalenes can become overactive as well. Teach them a better breathing strategy, and then teach them how to move the thorax independent of the head and neck, so that way they're learning better gait strategy as well, or walking strategy as well. And that's how you can become a go-to expert for these individuals who have cervical related issues to their balance. And if you're looking for more information, check out Posture, Balance, and Walking, a 3-part series my fellow anatomy geek Jill Leary and I put together to give you some strategy and resources to help you understand how the postural system is linked to the balance and how posture and balance are linked to walking. And not only do we teach you about the anatomy of posture, balance, and walking, but we give you strategies for assessing your client as well as incorporating corrective exercise into your routine so you can create these changes in your clients and help your clients. Even though you can't get rid of the issue, you can help your clients with posture, balance, and walking because they are linked. So check out the link, put it next to this video wherever you're watching this, and we look forward to seeing you in the 3-part series, the 3-part series of the 2 Anatomy Geeks, Anatomy of Posture, Balance, and Walking. And the CEC is available through NASM, ACE, and AFLA. So we look forward to seeing you inside the program. If you have any questions, put them next to this video, and we look forward to seeing you next time at Discover IMI. Make it a great day. Thanks for all you do for your clients, and thank you for being part of our community and allowing us to be part of your community. This is Dr. Evan Osar. Make it a great day.